Hello, my name is Anna Allen, and I am a sophomore here at ETSU, and the class that I am taking is called Intro to Service Learning 902 with Joyce Duncan. The agency that I was placed with for my service learning hours this semester was named Amedisys Hospice here in Kingsport, Tennessee. Let me share a little history about this organization. Amedisys was founded in 1982 by William F. Bourne, who himself was a nurse practitioner. The headquarters is based in Baton Rouge, Louisiana. What I found interesting and did not know was that hospice stands for the linguistic root of hospitality. Why does this organization exist? It exists to serve those in need of comfort and during the final stages of life. It is important because this stage of life has many new challenges which most people need assistance with. It also gives those who need a better quality of life and helps them enjoy the time they have left. Population that it serves: anyone with a terminal diagnosis of 6 months or less to live, as well as their families. Even though their main focus is to be with their patients, they also include the families that are part of the patient's life. So they're there to assist not only the patients, but also the families involved. They work to coordinate close with them and their families, as well as their physicians, to be able to give the best possible hospice care, and they are available to them around the clock. What I found very interesting about this agency was that the locations they serve. They serve many locations. To name them, let's see, they have Bristol, they serve Kingsport, Mount Carmel, Blountville, Rogersville, Churchill, Segornsville, and Bluff City. Another interesting fact about them is the services they provide. 24-hour on-call nurse, bereavement support up to 13 months, continuous care, dietary counseling, general inpatient care, hospice aid and homemaker services, hospice specialty care, medical equipment and supplies, nursing services, pain and symptom management, physician services, prescription drugs, routine home care, respite care, social work support. For root of problems of that population, that question was a little hard considering the agency itself, but actually there really was no real root problems. If anything, they would love to have more volunteers. Other than that, they really, I never learned or could tell from the agency that they had any true root problems. But I know they are always in need of volunteers. How they are funded. I personally work for a nonprofit organization, so I've never really been around for-profit organizations, which this agency is. It's a for-profit organization, and out of all my volunteering, I've always done nonprofits. So this was a little different for me, but I enjoyed it and I learned a lot. They are usually funded by Medicare or other outside insurance providers. How would the agency use extra funds if they were available? This was a question I was very curious about, and when I got the answer, it was very, very interesting to say. When they do have extra funds, which is not often, but when they do, they make it available to their patients, and they put it in this fund called the Our Dream Foundation. And basically what it is this dream fund gives the patients their basic last wish. Say if they want to go fishing on Boone Lake in a certain part, of the lake, or sit on a swing up in Gatlinburg, just watching the sunset, that type of thing. Basically, all those extra funds, when they get them, puts into this fund called Our Dream, and it gives them the last wish. Although not many have that opportunity like they'd like, but they at least try to, for those that can, get out and about and live that last dream of theirs. Some preconceptions that I had about the agency, I guess the best way for me to explain it is I had a slight idea of what it was about, but not fully, so I didn't know exactly what to expect. Um, I was skeptical about it because where I've always volunteered for children and my daily job consists of being around children, so I knew this would mostly be within our elder community citizens. Um, Basically, I was scared to experience the fact that it's based around the last moments of people's lives, and that made me kind of skeptical on being a part of it. But I wanted to be able to give back to my community, so I had to experience working with older people. And I won't lie, it was scary at first, but the more I got used to it, I enjoyed it. Um, I got to visit different facilities of theirs that they assist with hospice care. Holston Manor was one of them. I enjoyed being able to put a smile on their faces or just listen to them talk, but it would make me sad sometimes to go into their rooms and you compare it to others, and you can tell how often these individuals are visited or spent time with. And I think that was probably the hardest part for me, is knowing that there's these people out there that are alone, possibly scared, and wanting their family. But it made me feel good to know that could be that person for them. So there was good and bad to it. It's just, I guess, it made me open my eyes more. I enjoyed it, but at the same time, it did make me sad. Um, but my most fun part of it was being able to do courtesy calls, what they call tuck-in calls. Every Wednesday, I got to go in and help another volunteer with calling all patients within their homes and ask them basically if they were in any needs of supplies and so forth. And sometimes being on the phone with some of them was a cheery moment. It made my day go a little better. And it wasn't just a simple call and write down information. You could actually have a slight conversation with some of them, and it was very pleasant. Um, Another thing that I got to do was visit other patients at their homes and give them respite care. I found that very heartwarming and made you appreciate your community more. I did enjoy that. Um, how was I affected by the service? All in all, I would have to say I was optimistic at first, which I'm optimistic about a lot of things, but I feel that realizing what they do firsthand and what ways I could be helpful to them as well as my community, it it opened my eyes a little more and made me appreciate things a little bit more, especially with family. Um, I will say, though, that after this semester, I plan on continuing to volunteer with Emeticis, because not only are they warm and welcoming to you as a volunteer, but you meet very interesting people and you hear interesting stories. and it just warms your heart. Um, what I found unique about the agency is the dedication and hard work of the group of people that work there. They are made of a wide variety of people. Um, their interdisciplinary team is made up of doctors, nurses, nurse aides, social workers, chaplains, bereavement counselors, volunteers, and even veteran services and a management team. They are a well-rounded staff, and they're very heartwarming, and they're kind, and they're helpful. Um, if I could change anything about the agency, honestly, I would not see anything needing any change. Probably, like I said earlier, volunteers would be a plus because the more, the merrier. And to be able to share a little time and love to another person within the community, especially at their last moments of life, to make them smile and know that someone cares. It's heartwarming and actually very worthwhile. But all in all, I enjoyed my time there, and I informed them. I will continue to do so and pass the word along. They are a great agency and they do well for the community, and they're very kind to volunteers. And honestly, I'm very proud of myself for going out of my comfort zone and trying a different form of volunteering, and this was very beneficial. Um, and that is all I have. You all have a great evening, and thank you for listening.